Good day, Africa, and welcome to AAU Talks on AAU TV. AAU TV, the voice of higher education in Africa. Today we'll be discussing public health issues in Africa. My name is Irene Dufie Addai, and I am your host for today's discussion. We'll go for a short break, and when we come back, I would introduce to you the expert for today's discussion. Do stay tuned.
Are you an institution or individual? Do you intend to organize a memorable event to be archived for future reference? Then look no further than AAU Studios, because it's your best bet. With our spacious studio and state-of-the-art media equipment such as 4K Panasonic video cameras, KinoFlow lights, assorted microphones, live streaming machines, and others, you are sure to get the best of production. Visit us at Trinity Avenue, East Legon, adjacent the National Accreditation Board, or contact the AAU studio via the following addresses: info@aau.org, AAUTV@aau.org, Ransford@aau.org. Alternatively, you can call us on 0244 185 998 or 0244 693 342.
Welcome back. My guest for today's discussion is Professor Daniel Ganu, who is the Dean of Students of Postgraduate of Adventist University of Africa and also an expert in public health. So, Prof, thank you so much for joining us this morning, and we are very privileged to have you here.
My pleasure.
Right. Prof, we want to talk about public health issues, but before we go on, we want you to briefly talk about yourself so that the public will know more about you.
Good. Thank you very much, Sister Irene.
Yeah.
My name is Daniel Ganu, as you have rightly said. I am a public health expert, a professor in public health, and I'm a Ghanaian.
Right.
But I have been in Kenya here for the past 5 years as an expatriate. And I am the Dean, School of Postgraduate Studies here at the Adventist University of Africa.
That's right.
I am here with my wife, Professor Josephine Ganu, and I have one daughter, Grace Mawinyo Ganu, who is 15 years old and in high school.
All right, thank you. Prof, we want to zoom in on public issues in Africa, and then we'll come back to Adventist University of Africa.
Very good.
So what are some of the issues of public health in Africa in general?
Of course, Africa, we have a whole lot of public health issues, stemming from infectious diseases, and we have non-communicable diseases which are catching up with us. We have safety issues, we have occupational issues, we have diseases, outbreaks, and a whole lot of them. And of course, in Africa here, some of these issues are very endemic in most African countries. And my own country, Ghana, even in Kenya here. But Africa has made a good progress in terms of addressing diseases, but we still have a long way to go. If we will meet the UN
Charter.
No, the UN came up with the development goals. The sustainable development goals. If we are to meet that, we have a long way to go.
Right. So we want to know more. Can we talk about policy on public health?
Yes, Africa. I will zero into Kenya.
Right.
Kenya has quite a good public health policies, and some of these policies, Kenya, for example, has a Public Health Act 242. That is a policy that deals with a whole lot of issues in public health. It is very elaborate, and it talks about how we should implement and evaluate programs, public health programs, how we can address infectious diseases and non-communicable diseases, and how we can even recruit public health professionals. We have good public health issues, but I'm afraid to say that is on paper. When it comes to practice, we have a long way to go to implement these very good policies we have on paper.
Right. So, talking about issues and how we are not implementing the programs that we have put down, what are some of the challenges that we are facing because of public health issues in Africa?
Due to lack of proper implementation of these public health policies, we have issues confronting Africa such as infectious diseases. We still have them with us. Talk about diseases outbreak, Ebola, for example, the recent outbreaks, and cholera is endemic in many countries. But in addition to these infectious diseases, we also have non-communicable diseases such as diabetes, hypertension, cancer, and so on and so forth. That is coming forcefully to the continent of Africa. And so Africans, we are suffering from what we call double burden of diseases. We have not conquered our infectious diseases, and we are adding the non-communicable diseases. And because of that, our economy is suffering. The working group has a lot of diseases that are affecting them, and as a result, they cannot go to work, and our economy suffers. But most importantly is our health delivery. You know, we still have a problem with proper health delivery system in Africa. Our hospitals are not up to standard, and our hospitals are crowded with a lot of patients. So we need a lot of proper implementation, proper and sound implementation of some of these policies affecting our continent.
So whilst we are talking about challenges, as an expert, what do you think are the ways that we could to improve public health in Africa?
Yeah, first of all, I think we need more research done. Researches could be done, and these researches should not just rest, you know, somewhere in the shelves. But you know, they should be researches, epidemiological researches that can come out and to let us know what we are not doing right, what we can do right to arrest some of these problems. Secondly, I believe our governments need to do more and in enforcing or implementing some of these elaborate policies, public health policies that we have. And thirdly, we need awareness. When I come to Ghana, even in Kenya here, I find it very difficult to understand when we just litter all around everywhere. We need awareness. We need to educate. You know, when you go to the Western world, I once visited a friend in Norway, and we went hiking in the forest, and even banana that we ate, we put it in a bag. We came home and put it right in the trash can. They will not even litter in the forest. You know, and when you come to most of our African countries, you see our water bodies, they are quite polluted and contaminated. So we need health education, we need awareness. Our media houses should do well in educating the public, you know, and augment government effort.
Okay. So the traditional system is we going to the hospital and all of that, but in this 21st century where technology is in abundance, what is your opinion on online public health systems?
I am in the academia, and I think online delivery, education delivery is the way to go. Because let me take my school, for example. We are a postgraduate institution, a graduate school, and we offer only master's degree, we offer PhD degrees, and our clientele are working class group. Hardly can they leave their job and come and study full time. But when you offer online program, it gives them the flexibility to keep their job and also have their education in their own room, you know, in their comfort, in their rooms. So I think the online is the way to go. The problem in Africa is we tend to look down on online program. But let me tell the people, let me tell my colleagues and people out there that online is the way to go.
Is the way forward.
But if we do it right, it can address a whole lot of issues for us.
So we'll go for a short break, and when we come back, we'll continue our discussion on public health issues in Africa. In case you just tune in, this is AAU Talks on AAU TV. Stay tuned.
Are you an institution or individual? Do you intend to organize a memorable event to be archived for future reference? Then look no further than AAU Studios, because it's your best bet. With our spacious studio and state-of-the-art media equipment such as 4K Panasonic video cameras, KinoFlow lights, assorted microphones, live streaming machines, and others, you are sure to get the best of production. Visit us at Trinity Avenue, East Legon, adjacent the National Accreditation Board, or contact the AAU studio via the following addresses: info@aau.org, AAUTV@aau.org, Ransford@aau.org. Alternatively, you can call us on 0244 185 998 or 0244 693 342.
Welcome back to AAU Talks on AAU TV. We are discussing public health issues in Africa, and the expert here with me is Professor Daniel Ganu, who is the Dean of Student Postgraduate in Adventist University of Africa. Prof, before we went on the break, we were talking about online mode of delivery.
Yes.
But we want to know, what is the Adventist University of Africa doing on public health issues?
We offer, as I said earlier on, we offer master's degree in public health. And this program started in 2014.
Right.
And so far, we have graduated 12 students. 12, and we are proud of our graduate because we train them to give them the competencies they need to address public health issues in the 21st century. Our students have a cutting-edge competencies they need, and we are proud of them because this school, being a postgraduate university and Pan-African university, they meet a lot of students from other parts of the continent of Africa and even beyond. And then they can network very well. The School of Postgraduate Studies offer courses such as master's degree in computer science, master's degree in business administration with several areas of specialization, such as accounting, finance, management, healthcare management, and information systems. And then we also offer a master's degree in leadership and PhD in leadership and all other degrees. And that is the school where I am the dean. And you have seen our campus, very serene campus for academic work. And we carefully select our faculty members from all over the world. We are not limited only in Kenya, in Ghana. Our faculty members come from US, from Europe, and even from Asia. And that is one advantage this university has. For example, last year we had an international conference, and we have people coming from Harvard University to this conference. So that tells you that we are really international institution.
That is very well. And then we know you also have a postgraduate in public health.
Yes.
But what was the reason of establishing just postgraduate and not undergraduate?
Yes, the Seventh-day Adventist Church has several undergraduate universities within the continent. And we don't want to duplicate what they are doing. We want to be unique, and we want to train leaders for the continent of Africa. What we need now in Africa is leaders who have integrity. And we are, that is our core value. One of our core value is integrity, knowledge, and then service and truth. And integrity is core part of our core value. And so we believe that when we train leaders in public health, we give them the skills and the competencies they need that can address the public health issues in the 21st century.
So anyone who wants to do public health programs, what are some of the courses that are being offered here in this institution?
Very good. We offer master's degree in public health, in environmental science, and then in human nutrition, in health promotion, in epidemiology and biostatistics, in community development. So for public health, these are some of the courses we have currently, and we will keep on adding.
Okay. So whilst these are people who are working, do you employ the services of online internet to do your teaching? And
exactly. We have, when you come to this campus, we have one of the best internet band that can really accommodate online service. In fact, we received from Kenya the university that has the best internet service, and then the university, we have won the award of the best library in Kenya.
Right.
So we offer our programs online. Coming this October, we will roll our public health program fully online.
Right.
But currently, we offer a blended learning, a blended delivery. We blend online with the face-to-face.
Okay, so it can't be all rosy. What has been some of the challenges of running this program here in the university?
Yes, you are right. We have challenges also. Number one is what I said earlier on. Our students, our potential students are working class.
Right.
And mostly we have medical doctors and nurses in our programs. It is difficult to get them to come and study fully on face-to-face. And that is one of the main reasons why we are going online. They cannot stop their work to come and enroll and study. They need to have a flexible system.
Right.
It has been one of our challenges. And secondly, we also have many schools that are offering public health. So the competition is keen.
Right.
The competition is keen. We need to do things differently to get ourselves unique for people to prefer coming to AUA.
Right. And since it's a school in a community, what has been some of the impact of the public health program to the community in and around?
Very good. I believe when you were coming, you passed through the town, Rongai. They have a market. Very often we go there to clean the market for them, and then to help them to help the drainage system, and we organize, and the whole community of the students' body go there to do the work. And more so, we have most of our students going out to do health education outside. And we also, just last month, we brought some of the youth in the community, and we trained them with a program we call the YES program. And we train them and equip them, give them skills that can help them get a job somewhere.
Okay. So we are going, and our last word, what is the way forward for Adventist University of Africa to improve public health system across the continent?
Good. We are doing a lot, and one of the things we are doing is that we want to offer our program fully online. But we would like to invite you to come and join us, to come and partner with us. If you go to our website, www.aua.ac.ke, you will locate us. And then my email address and my telephone number, I believe you will put it online,
or will be shown on the screen.
Yes, will be shown on the screen, and you can contact us so that we can train ourselves. We believe that our training will equip and give our students skills we need to address the 21st century public health issues in the continent of Africa.
Thank you, Prof, for joining us. It has been a very great interview with you, and also an exposure for Adventist University in Africa. Viewers, this is AAU Talks on AAU TV. Thank you for joining us today. Bye.